Open surgery is still existent and still sometimes used, but between the two, for a primary hernia or the first time hernias. Hi, I'm Dr. Deepak Subramanian from Chennai Gastrocare. What is the best surgery? Is it open surgery for hernias or laparoscopic surgery for hernias? Now, open surgery, as you all know, has been there in the limelight for so many years. People have been doing open surgery ever since surgical techniques for hernia has been started. So obviously, open surgery is basically a large cut through which you enter into the hernial area, you close that whole hole, you put a mesh on top, and then you come out. This is open surgery for hernia. Laparoscopic surgery is nothing but like a keyhole technique or minimal invasive techniques, where 3 or 4 small holes are inserted, a camera is there, and you have operating instruments through which we correct the same hernia as how we would do it in an open surgery, or sometimes even better than how we would do it in an open surgery, with minimal amount of pain, minimal amount of infection chances, minimal amount of seroma, we call as the fluid that is formed after surgery. All these are much reduced in laparoscopic surgeries compared to open surgeries. So the patient recovery becomes extremely fast. The patients are up and about and they walk back to their houses the next morning without any pain, and they're able to go back to their routine activities and go to routine work in about 2 to 3 days after the surgery. So obviously, when you look at a patient perspective and from the quality perspective, laparoscopic hernia surgery is much better than open surgery. But there are certain types of subset of patients where laparoscopic surgery is not feasible. This could include a very large hernia where we call as a loss of domain. This could include things like where previously the laparoscopic hernia surgery done has been a failure, so we cannot employ the same method, we may have to go for an open surgery. So yes, open surgery is still existent and still sometimes used, but between the two, for a primary hernia or the first time hernias, laparoscopic surgery is always the better choice and a much better for the patient in terms of recovery. Thank you.